I'm Dr. Craig Escude. Welcome to Medical Monday. There are so many things that can contribute to a person falling. And it's important to look for reasons. When we see a person that we're supporting with an intellectual or developmental disability that is starting to fall or is having an increased number of falls, that needs to be evaluated because, as we know, you can hurt yourself pretty bad from a fall. So what are some of the causes? What are some of the more common things? Well, one thing to consider is the medication that a person is on. Is it sedating? Is it causing drowsiness? Is it causing dizziness? Could it be, let's say, a person who is getting older is starting to have more falls? Could it be something like arthritis, where they're having pain in their hips or ankles or knees, and they're having some instability from this that's causing a fall? It's certainly a possibility. Seizures sometimes can present as a person falling. If a person just is falling more often, are there things that you can identify that maybe look a little bit like a seizure that might be causing the fall? Also, could it'd be a vision issue. What if the person is not seeing as well as they normally are, so they're tripping over things or they're not able to differentiate if there's a step up or down, and so they're falling because of that reason? Could it be, an ear problem? Could it be some sort of dizziness related issue or middle ear type issue? All things to be evaluated. Dementia, as a person, again, gets older. Sometimes dementia can cause other issues, including mobility issues and balance and muscle weakness that can contribute to these things. So it's important to evaluate possible causes and do what you can to prevent them, such as, if there's a reversible health condition or something that can be improved on, then we certainly want to treat that. We might want to look at the environment, removing hazards like cords or small tables or, loose rugs, things like that. Make sure there's adequate lighting, especially in the evening time. Let's say a person is falling when they go to the bathroom in the middle of the night. Make sure there's lighting available. We might need to install handrails and grab bars. Bottom line is, if a person is falling, don't just say, oh, they're doing this just because they're getting older or whatever. Look for causes, do what you can to reverse them, and also create an environment that is the least likely to cause falls. You can find out more information in Clinical Pearl 12 from the book Clinical Pearls in IDD Healthcare. Many of the topics that you hear on Medical Mondays comes from the book Clinical Pearls in IDD Healthcare. It's a great resource guide that provides helpful clinical information to anyone who provides support for people with intellectual and developmental disabilities. This includes family members, direct support professionals, nurses, physicians, and others who work in the field. You can find it at replacingrisk.com. That's replacingrisk.com in our store.